Our first presenter is going to be Randy Kurohara. Mr. Kurohara is the Executive Director of Community First Hawaii. He served for 8 years with Mayor Billy Kanoy in various roles, including Director of the Department of Research and Development, Deputy Managing Director, and Managing Director. Mr. Kurohara is also a longtime Hawaii Island small business owner that includes Creative Arts Hawaii and Aloha Grown. He graduated from the University of Hawaii at Manoa with a Bachelor of Business Administration in Marketing. He is a member and past president of the Rotary Club of South Hilo, director and past president of the Japanese Chamber of Commerce and Industry of Hawaii, board member of the Kona Kohala Chamber of Commerce, vice president of the Hawaii Island Chamber of Commerce, board member of the Hawaii Health System Corporation's East Hawaii Regional Board, board member of the Salvation Army, board member of the Kehole Center for Sustainability, and emeritus board member of the Boys and Girls Club of the Big Island. With us as well today is Lisa Rantz. Ms. Rantz is the executive director of the Hilo Medical Center Foundation, which also serves as the Hawaii Island Area Health Education Center, facilitating health careers, recruitment across the workforce pipeline, high school through graduate medical education, professional development trainings, and collaborative group activities. Ms. Rantz is also the president of the Hawaii State Rural Health Association, secretary for the Hilo Rotary Club Foundation, and was appointed by the governor of Hawaii to the Hawaii Medical Education Council in February of 2018. She has over 15 years of facilitation and focus group experience in both the education and healthcare industries. She has developed programs to assist researchers, educators, policymakers, and rural residents to address changing rural environments by identifying and researching rural health issues, analyzing health policy, strengthening local capabilities, developing community-based alternatives, and advocating for rural health issues. It is our great pleasure to have both Mr. Kurohara and Ms. Rantz, Randy, and Lisa with us this evening. And now I turn it over to Randy to begin our evening.
All right, thank you so much, Mark and Lisa and Beth, and aloha to everybody out there. This project called Access to Care, Health for Our Communities. In April, we're launching, so April 1st, which is tomorrow, we're launching our statewide campaign. So Community First is a nonprofit organization. Our main goal is really to bring people together, our healthcare providers, social service providers, government leaders, policymakers, and really serve as a catalyst to improve health and healthcare. Our goal with the Access to Care campaign and project is to better understand what Hawaii needs to improve timely access to healthcare services, and again, as close to home as possible. We started in the month of November last year with a pilot on Hawaii Island. And tomorrow we're expanding to a statewide survey covering Kauai, Maui, and Honolulu counties. And we'd like to mahalo HMA for your support and partnership, but also the rest of our partners that we have here on the screen: Hawaii State Rural Health Association, HMSA, Pacific Telehealth Resource Center, the Hawaii Health Systems Corporation, and the Department of Health for the state of Hawaii. I'm going to turn it over to Lisa now to cover some of the results we had for Hawaii Island.
Thank you, Randy. So as Randy stated, this is a very important project for our state. We are hearing all sorts of things anecdotally about what's happening in our healthcare system, both on the positive end of things, and also on the struggle end of things. And what we want to do is we want to shore up, help build out the infrastructure to make it possible to bring resources to the neighbor islands to form a system of care, right? So what does that look like to work together to establish that? And that's what Access to Care is all about. So we want to hear from our community members. We want to hear from our providers. We want to hear from the social service folks, our community health workers. All these voices are important and valuable to let us see the landscape of the land, right? So we hear that patients have trouble finding a provider, but then providers say, oh, but we're accepting patients. But then our low reimbursement rates don't allow them to take all of the patients. And so that's just a little sneak peek. We'll get into some of the data highlights. The full report for Hawaii County will be available tomorrow with the statewide launch and the launch of the website. And we will make sure that you all get a link to that. And there's a little short 2-pager as well. So we just are going to continually plug along on this and ask you to take the survey if you don't live on Hawaii Island. And, it's going to be launching on statewide. Take the survey and make sure that you get this survey out to your friends, your colleagues, your neighbors. We want all of the voices, not just folks in healthcare, right? Health is the core of everything. So that's what we're trying to do here. And so we'll get a little bit into the survey results. We see a split here. 45% of our community members on Hawaii Island felt that the community is unhealthy. 59% of providers, 90% of which were full-time practicing on Hawaii Island, feel that the community is not healthy. And of course, they're seeing folks come in with chronic conditions and unmanaged care. And then on our next slide here, we will look at this, one of the central problems, and that's the workforce shortages that we have across the system. And oftentimes we hear policymakers say, oh, well, if we don't have enough physicians, then we can, bring in APRNs or physician assistants to fill in that gap for primary care. And the truth of the matter is that we have shortages across the workforce spectrum. So it's our primary care providers, our specialists, physician assistants, APRNs, and to make it even more complex, with telehealth now available, we're hearing, and this is one of the things that we want to get more results on statewide, is more providers are starting to provide care via telehealth to mainland patients because they get a better reimbursement rate. And then they have limited hours or are not seeing any patients in the state of Hawaii. And so that's just heartbreaking, because we understand that providers also need to deal with the high cost of living and be able to put food on the table and take care of their families and those things as well. So those shortages run the expanse. And here you can see on this slide, I'm not going to read the quotes, but waiting times are pretty exorbitant, more than a month. A lot of folks are waiting to see a specialist. We hear folks waiting 4 and 6 months for referral to specialty care on Hawaii Island. And then on this next slide, no surprise here, is a lack of physicians. 76% or 7 in 10 people on Hawaii Island feel that that is the biggest access barrier for them, is a lack of providers on Hawaii Island. And then, little bright spot, we have to put those little positive things in there, is 21% of folks said that they could see a provider when they wanted to. So next slide. In the initial results, when we are looking at what folks said that they needed the most for referral or for their care, and this, especially with COVID, we're seeing much more with the behavioral health and mental health supports, stress, anxiety, depression, just not being able to cope with the day-to-day, or not being able to reintegrate and sort of get back into that rhythm. And we don't have enough psychiatrists and mental health counselors to see patients. And so that is what we are experiencing here. And then there's a long wish list of providers. I'll let you read that in the full report. But we also need an increase in our social services. We need addiction and recovery, issues with the houseless, and more cultural fluency. So we heard that time and time again, and the health equity. And then of course, the last bullet here is, when we look at prevention and early intervention for mental health was big, and maybe going into the schools and doing some work there. And then what is driving these shortages? And I don't think that this is a surprise to any of us as we live here and work here and listen to both on the community and the provider side, is the economic issues. We have a high cost of living. We have a lack of affordable housing. And we have a tax burden. A lot of the, well, we have the general excise tax, which is a progressive tax. And it makes it very difficult for our solo and small practice providers to make ends meet with the low reimbursement rates and the tax burden that they face, because they cannot pass that tax along to Medicare and Medicaid patients. It's actually illegal by federal statute for providers to pass on the tax on medical services. So sometimes we hear, oh, well, you can just pass on that tax. So if the price of lettuce goes up, you can add that cost and pass it on to the consumer. In the case of healthcare, you cannot pass that cost on to the consumer. And so there's a finite sort of wiggle room there. And it's more expensive to have things shipped here and medical supplies. And then I already did mention the low reimbursement rate, but that did rise to the top again and again throughout the survey.
Lisa, if you don't mind, I'm going to stop you right here just really quickly and voice one of the questions in the Q&A, which is behind psychiatry and mental health, what were 3 of the top shortages for medical specialists, since we can't see the report right now? Do you happen to know what the other top specialties were?
Yeah, so let me scroll here. So ENT, we don't have dermatology. Gastroenterology was a big one. Cancer services. So runs the gamut.
Thank you.
Mm-hmm.
And sorry to roll back to the beginning there. I apologize to our audience because I didn't see this question in QA earlier, where they asked, one of the participants asked, what comments did you get to explain why the community was unhealthy? Or what do you attribute the difference between responses of providers and the community?
So I'm trying to look at it in the chat box because it was a little hard to follow.
Right. First part, I think, is just they wanted to know, did the survey, the people who took the survey, explain why do they think the community is unhealthy? And then
so there were some choices in the question that they could answer, whether that's, the school system or crime rates, access to healthy foods, access to medical care services. So those were all listed out, and there's percentages there within the report that Dr. Saltman can take a look at. We can make sure that he gets a copy of the report when it's released tomorrow.
The second half of that question was a little bit harder to, I don't know if this was borne out in the survey, to what do you attribute the difference between responses of providers in terms of, is our community unhealthy or healthy, and the community, is our community.
And so in the qualitative, in the focus groups, and in some of the comments that folks were able to leave within the survey, what was sort of teased out was that some of the populations that typically we see these inequities don't feel like they need to go to a provider. They accept the fact that they have diabetes or a chronic condition that has been in their family for generations, and that they just accept that they're going to have an amputation of their leg before they're 30 years old, instead of getting on medications and getting managed. So they don't culturally perhaps feel like they needed to go in and see a provider. And then the providers see the chronic conditions, they take care of the patients. And so that's what we're seeing in the comments is, due to, the high volume and not having the wraparound services and being able to have quick referrals to specialists and things like that are what were teased out in the survey.
Thank you.
Mm-hmm. And then did we want to address Ellen Novak's question too?
If I may suggest, why don't we go ahead and continue with the presentation, and then we'll be able to come back and spend appropriate time with the Q&A, and then I'll introduce Dr. Ignacio and Dr. England after your presentation. Thank you.
We just have a few more slides here. And so when we were looking at the responses of providers and patients, the longest wait times were for Medicare and Medicaid patients, especially the Medicaid patients. And so the patients that could least afford it, have the most chronic conditions, and struggle with the broadband access, transportation issues, access to healthy foods, really showed those health inequities within those populations, the Native Hawaiian populations, the Kofa populations. We also saw that telehealth benefited the white educated population the most. The more affluent, the better the access. So, just showing some of the social determinants of health were coming to the top. And we did have providers' comments here about, bringing in a workforce that is more reflective of the community and understands cultural protocols and competencies and can actually meet patients where they're at and not say, oh, well, you should do this or you shouldn't eat that food, right? When it's part of their culture to do those things. And so to approach it in a different manner. And so those were some of the comments that came out. And then on the next slide, how are patients in our community impacted by this? So when patients are not able to get their care locally, we're seeing more chronic disease in our rural areas. We're seeing more complications. We're seeing people die of things that they shouldn't die of or that they don't die of on the mainland. So that's one of the big issues there. And then some of the comments, and this was from a Hawaii Island resident right on the top, percentage is a realtor, obviously, are older people that are moving away to the mainland. And like we said, anecdotally, we're hearing many people in all walks of life saying, well, once they reach a certain age, or if they develop a heart condition, then they're going to have to move because it's just not worth the risk of staying in Hawaii. And then with the high cost of living, more people are, and I'd like to go to the next slide, actually, contemplating moving to the mainland. And this was the Hawaii Island providers. Almost 50%, almost half of the providers that filled out the survey are considering reducing their hours, leaving medicine entirely, or moving to the mainland. So that was a little bit shocking to us to see that it's to that extent. We hear the struggles, the burden of not having enough support services, things not the lack of care coordination, right? So all of these things are areas in which we can bring together work groups. And that's what we want to do once we finish the statewide survey, is to take the survey results. We're going to be presenting them at the annual Workforce Summit for AHAC. And instead of that being a passive conference where you go and you listen to speakers, we're actually going to present the statewide results, and we're going to form active work groups to move the needle forward. We shouldn't continue to say, oh, well, we have an increase in our provider shortage year over year. Well, what are we going to do about it? What are those things that we need to put in place, right? We've tried lowering payment. We've tried preceptor tax credits, right? We need to do something with the general excise tax. The hospitals don't pay it. The FQHCs don't pay it, but our sole and small practice folks do. And they're the front lines taking care of our community members and our most vulnerable community members at that. And so, we need to look at ways that we can work together, and then we can take the resources, we can work together to leverage that to take a look at what's taking place. We are getting data from insurance companies. HMSA actually is providing what services are being flown off island. and having to go to Oahu for care. So we're getting that by procedure code. So we'll be able to say, oh, well, you know, we have a whole bunch of sinus infections that can't be seen on Hawaii Island or on the Kona side. And so they're all flying to Oahu, or they're being seen on the mainland. Do we have enough of that population to bring in that provider, right? So it can help the insurance companies to recruit. It can help the healthcare systems to identify where to put their dollars to be able to have a provider to take care of the population so that folks don't have to fly off island for care. So we're really looking at trying to form those systems of care and where the care is needed. And that's why it's so important to get everybody's voice heard, right? We actually, on the next slide, we're going to go into the statewide launch. And so we can bring that slide up, and then I'll just talk briefly, and then I'll turn it over to Randy to talk about some of the outreach efforts. But with the survey, we actually are monitoring it in real time and looking at the zip codes and the data that's coming in. And if we're seeing that we're not getting enough surveys in specific zip codes and specific demographics, then our team is going out and we've got paper surveys, we're translating surveys, we're making sure that those voices are heard and that they're represented within the survey. So an example of that, you know, say down the Ka'u Ocean View area of Hawaii Island, we have a big Marshallese population. If we don't have surveys in that area, we're going out into that area and we're actually obtaining those surveys. And that's what we're doing on the statewide effort as well. We've engaged with the rural health associations on the various islands and with key social service groups that work with the different populations so that we can ensure that everybody's voice is heard. So that's kind of our plan of attack on that.
Thanks, Lisa. So if we could go back to the other slide, please. Yeah, okay. So again, our statewide launch of the public survey starts tomorrow. So again, you know, please, if you could encourage all of your friends, family, peers, colleagues, networks to, you know, engage with the survey. We really appreciate it. During the months of April and May, we'll be also convening focus groups throughout the state that are around providers, healthcare providers, social service providers, policymakers as well. And the goal is to, by the end of late summer, is to have the final report released. So we're doing reports by island, but also one final comprehensive report as well. So again, by tomorrow, when you go on to the accesstocarehawaii.org, you should be able to view the Hawaii Island final report, which will be there. And then by the end of summer, we'll have the rest of the state done as well. Next slide. So again, the statewide surveys will go into putting together a comprehensive report. And again, the whole goal, as Lisa was saying, was to really come up with some actionable items so that we can affect, you know, policy change, healthcare practice, and also resource allocations. Next slide. Oh yeah, and finally, we're going to do an incentive. Can't do a survey without an incentive. So every week we're going to be drawing a $100 gas card, which would be a great incentive at, you know, this time for everyone who fills out a survey. So, and one more thing, the survey, the online survey, you have an option if you're a provider or just a resident filling it out. So when you get into the survey, it'll take you to questions if you're a provider that are specific to the providers that we want to survey as well. I think that's it. Oh, sorry. Every voice matters, right? So again, here's your chance, right, to lend your voice to improve healthcare resources to all of your communities, right? So getting as many people to fill it out as possible. And again, if you have a network, if you have an organization that has any social media efforts as well. If you could help, work with our team to get more social media posts being done throughout the state, I think it all makes for a great campaign. And again, just your help with your grassroots team, with your, again, with your friends and family. We will have an outreach team that will be out in the community. So again, if you have the resources, you have people that want to be engaged in this, then again, work with us, and we'll definitely use your help. And I think that's it.
Yeah, like Randy said, if we'd love to have you involved in this. We did a series of focus groups on Hawaii Island as well. And we're actually starting the focus groups for the statewide effort next week. So on April 6th, so Tuesday the 6th, trying to look at a calendar here, sorry. Wednesday the 6th. So 6th and 7th. So we're going to pull a focus group of primary care providers on the 6th. We can put this in an email and Mark can share it. But we have some focus groups scheduled to talk with the different groups. So we'll do primary care providers, specialists, the hospitals, FQHCs, the COFA groups that are working with our COFA populations, our Native Hawaiian health system. So we have a series of focus groups coming up to get the qualitative pieces. So if you know people who would be good to lend their voice to that, if you could go ahead and outreach to us, we would be very grateful.